And a very good evening to you. I'm Jennifer Sanders. Thanks so much for joining us. Well, the state says the first COVID-19 vaccine will be given in just a few weeks. And as we learn more about the distribution process, pregnant women are asking their doctors if it's safe for them. So far, they have not been included in the vaccine trials. And as KXAN investigator Arzo Dost explains, it could be months before OBGYNs know more about the impact on pregnant women.
Dr. Anisa Hussein has long waited for this moment.
I am beyond excited. There's just absolutely no words. And if you know me, I'm not the type of person that typically gets speechless.
The first-time mom and doctor from Austin says she's been extra cautious the last 9 months, especially since she treats cancer patients. She feels hopeful about the COVID-19 vaccines, but has a lot of questions about the impact on her and the baby.
After you get the vaccine, really what happens? Do you transmit immunity to your baby? Is that safe? Are you safe? Do you have any long-term side effects? Does baby have to be revaccinated? It's just such a question mark that I just don't think I'm quite ready yet to say that I would put myself in that position.
Some OBGYNs say they're telling patients to wait to get the vaccine, especially since trials haven't included pregnant women.
We want to know that we have safety data before we universally recommend it. So the CDC will go through the data unequivocally before they give us guidance on should pregnant women receive this or not.
Dr. John Thopel is the president of the Texas Association of Obstetricians and Gynecologists and says it could be months before they get that guidance. He says even among women breastfeeding, there needs to be data.
It's important to encourage your family members, those around you, to get vaccinated because that's the best way that they can protect you.
Do you think it'll be safe?
I think at this point, we probably don't have enough information to say that it is safe in pregnant women, but there are certain cases where it may be worth taking those potential risks. Patients who are at high risk from getting very sick from COVID.
Dr. Madeline Kay, an OBGYN at Renaissance Women's Group, says you should talk to your doctor. She says typically during a vaccine trial, pregnant women are included after it's been confirmed that it's safe and effective.
Sometimes those are trials that are done retrospectively, meaning that eventually pregnant women will just start getting the vaccines and then they will look back and make sure that they have been safe in that population as well.
Dr. Hussein says for her, waiting might just be better.
I think that I would feel more comfortable having probably another 6 months to 12 months to really see if there's any long-term side effects.
Arzo Dost, KXAN investigates.
And we reached out to Pfizer, Moderna, and AstraZeneca. Those are the pharmaceutical companies behind the vaccines. Now, we asked about future trials and research, including pregnant women. Here are those responses. A Pfizer spokesperson says the company is working on a pathway to build a maternal indication into the program. Moderna has not responded to our questions. A spokesperson, though, with AstraZeneca says they hope to include pregnant women in the eventual group of people for whom the vaccine is approved and are carrying out necessary preclinical studies. The Texas Department of State Health Services submitted a COVID-19 vaccination distribution plan to the CDC and says it's still unlikely that pregnant women will be recommended to get the vaccine at this point. A spokesperson, though, says there's usually quite a bit of evaluation before recommending a new vaccine for a pregnant woman. Now, the CDC says pregnancy increases risks for severe illnesses from COVID-19, and pregnant women are more likely to be admitted to the ICU, receive ventilation. As well, they are at a higher risk for death. It's one reason the agency recommends they get the flu and whooping cough vaccine. The flu shot could be at any time during the flu season and can protect both the mom and baby for several months after birth from flu complications. The CDC recommends getting a whooping cough shot during the 27th through the 36th week of pregnancy.